Okay, we're headed back into our consult rooms.
We're going.
We take a three-dimensional picture of the head and face. Super helpful, just like with breast surgery, to calibrate the expectations and what a patient sees with what I see, and now we're communicating together in terms of what our goals are and making sure that those goals really do match up.
Okay.
So let's take a look at your picture.
Okay.
Here's your picture. And so the rest, I think, I would argue, does look a good bit like you for the nose, and we can look from these different perspectives. This is it, right? That's the bump?
Yes, exactly what I see.
So in your case, as we're doing this, I would, in your case, for the type of rhinoplasty we're going to talk about, in my hands I would do what we call an open rhinoplasty. Open rhinoplasty versus closed rhinoplasty is really all the definition differences is whether we're making an incision across the base of the nose here, in this area we call the columella. Everything else I've got like English words for. I don't have English word for this. But we make an incision across the base of the nose here, and then the rest of the incisions are inside the nose. That's an open rhinoplasty procedure. Closed rhinoplasty simply does it from incisions inside the nose exclusively. And my preference for the open rhinoplasty, particularly when we're making modifications for the tip, which I believe is something I'm going to talk about for your case, allows me to have direct visualization. I think for me the most control of that procedure. Afterwards, in either case, you would have a splint over the back of the nose and small, generally, not every case, but many times you'll have small soft splints on the inside of the nose. Those stay in for a week, and then after a week, we see back, we take all of that out. And at first, as soon as we take a splint off and any sutures out, you get swollen, okay? So I think it's generally a good 2 weeks to have kind of a more normal version of yourself where walking down the street in public at the store, you look more like someone who didn't just have an operation on your nose. And that's an important consideration initially. But at 2 weeks, you still do have residual swelling that takes a good bit of time, probably really a year to fully go away. But by 6 weeks, I think a large percentage, maybe 90% of the swelling is gone. And then slowly is going to taper down from there. Okay, here's your picture. We're going back to it. And for the shaping, I love this simulation tool. It is not surgery. I cannot just go in the operating room and say, boom, we're going to take the bridge down. Boom, we're going to move. So, and it's not going to be exactly the result we get for sure. But what is most helpful is if I hear you going, ah, as I'm doing this,
Exactly, right?
that's helpful because I know if we're getting it right or not getting it right and if we're seeing the same thing. I just lowered the bridge some here along the back of the nose. Here I look at raising the tip of your nose just a little. Now I look at this and proportion-wise, I would say we would reduce the whole nose some. So some reduction of the nose, some reduction here of the back of the nose, and some slight elevation of the tip. Then as we come to the front, I would look at now, we've made you shorter but kept the same width. That makes the nose appear wider, just out of the gate. So looking at that, I might look here at the base of the nose and say, or the tip of the nose rather, and again looking at that triangle, if you will, here of the tip of the nose. And I can even blow this up so it shows a little better on the screen.
Whoa, Sierra, I can see inside your nose.
Sorry, apologies in advance. So I have my morphing tool here and bringing that tip in. I definitely don't want this pinched look. In fact, this really is upsetting to me to see this pinched appearance. I'm working definitely to avoid that, but a little bit narrower. So our starting point was here, and you can see it looks a little bit wider, particularly now that I brought the back of the nose down. And now I would look at not getting things pinched, and that's why I do look from this base view as I'm making these adjustments on this simulation tool. And I think that probably is pretty good. I would look here at where the bones and the sidewalls of the nose here are and look at bringing things in just a little. So if you focus in on this area, you're in this range now. I look at bringing things in just a little bit. Again, family reunion, right? We're not trying to have a done nose. I am definitely working to the best of my ability to get a fairly natural appearing nose. So if we go in, view results, we can go and compare your sort of pre and post simulation side by side. But then also I generally here work and compare the two. So this is the change appearance and here is your current appearance. And oftentimes even these angled views give us a good appearance. So some reduction on the sidewall volume, some reduction in the tip volume, and some reduction in along the back of the nose.
Well, what if I'm the kind of person who thinks about my nose 100 times a day and I want Jessica Simpson's nose? Am I a good candidate?
Yeah, I don't have a problem with people bringing in examples of other people's noses and saying they like this nose. I'm going to look at what features about that nose you like and does it compare to you. If it has no comparison to your tissue type and the framework of your nose, then I'm going to say, okay, I like that nose too, but it's not you. Or isn't something that we can move to. But there's nothing wrong with saying these are the types of appearances that I like.
Absolutely. Well, I'm so glad that we got to do this today, and I think it's so powerful for our patients to see this that are coming in and get to see that the Vectra and get to visualize that with you. So thank you for letting me be your patient.